Okay, now we will be talking about epiploic foramen. So, remember in the previous video we showed that between the liver and the lesser curvature of the stomach is lesser omentum, and behind lesser omentum and the stomach lies the lesser sac. So, this is the area of the lesser sac which is behind the stomach. So, what are the structures in the lesser sac? In other description you may also mention it as structure lying in the stomach bed. So, structure lying in the stomach bed are the left kidney, left suprarenal, spleen, pancreas. So, here is the head of the pancreas, neck of the pancreas, body of the pancreas and tail of the pancreas. On the superior border of the pancreas, this is splenic artery, and we can also see a diaphragm. So, these are the structures forming the stomach bed which are lying behind the stomach and the lesser omentum. To repeat again, diaphragm, left kidney, left suprarenal, pancreas, spleen, splenic artery, and these are main structure. Now, we should also go to some clinical relevance of this structure. Suppose there is some perforation in the posterior wall of the stomach. So, the exudate will come through the posterior wall and it can affect pancreas, forming pathology of the pancreas like inflammation of the pancreas. It can also affect the splenic artery, maybe rupturing splenic artery in rare occasion. It can also involve the kidney forming pyelonephritis. So, the lesser sac and exudate occurring in the lesser sac is a very grave emergency, because this is behind the stomach. For surgeon to go into the lesser sac is quite difficult. So, we have already mentioned that the lesser sac and rest of the abdominal cavity is greater sac, correct. So, what actually connect the lesser sac with the greater sac? So, in this model you can see the interconnection between the lesser sac and greater sac. So, this is a transverse section, and you can see the liver over here, spleen, stomach, this is gastrosplenic ligament, this is splenorenal ligament connecting spleen with the kidney. So, this is all greater sac, This is stomach, and behind the stomach you can see the lesser sac. So, lesser sac on its right hand side through a small foramen called epiploic foramen continue into greater sac. So, what structures forms the boundary of the epiploic foramen? Anteriorly is the right margin of the lesser omentum containing portal vein. In front of the portal vein is bile duct and hepatic artery, and behind the epiploic foramen is the inferior vena cava, and towards the upper part will be lying the chordate process, and below will be the first part of the duodenum. So, what is the importance of the epiploic foramen? Suppose you have got a pathology over here, some exudate collect over here. So, this exudate first go beneath the liver in subhepatic space, hepatorenal pouch of Morrison. From hepatorenal pouch of Morrison, this exudate can enter through the epiploic foramen, and through the epiploic foramen it can enter into lesser sac. And once it goes to lesser sac, it becomes very difficult for any physician to actually go to the exudate and clear it, because you see the sheer difficulty, because all this collected fluid is lying behind the stomach and behind the lesser omentum. So, we will see the hepatorenal pouch of Morrison also. If you see here that this is here we are actually, if we produce the liver here, this is liver. So, between the diaphragm and the liver, right lobe and left lobe, this is called subphrenic space. So, right subphrenic space and left subphrenic space. But beneath the liver there is another space, this is called right subhepatic space and left subhepatic space. So, left subhepatic space is actually lesser sac. So, what constitutes the right subhepatic space? The right subhepatic space is between the right lobe of the liver and kidney, hepatorenal pouch of Morrison. So, this hepatorenal pouch of Morrison, when the person is lying in the supine position, this is the most dependent part of the peritoneal cavity. So, if there is any exudate, any blood collecting in the greater sac, it always collect in the hepatorenal pouch of Morrison. So, you may be surprised that if there is a collection of fluid in the hepatorenal pouch of Morrison, what is its fate? One fate I already told, that it can go through the epiploic foramen and enter into the lesser sac, correct. Another way of the fluid going through here is through this. So, from the hepatorenal pouch of Morrison, it comes the infracolic compartment. So, towards the right side is right paracolic gutter, towards the left side is the left paracolic gutter, and inside these are called right infracolic and left infracolic space. So, fluid from the right hepatorenal pouch of Morrison can go to the right paracolic gutter, and from right paracolic gutter they can go to the pelvic cavity. And in the pelvic cavity, the deepest part is between rectum and uterus, recto-uterine pouch of Douglas, or in case of female, or in case of male, it is rectovesical space. So, the fluid will gravitate here. But you may also ask me that can the fluid here in the greater sac can go to the left? No, no fluid can go to the left paracolic gutter. What is the reason behind it? If I now remove the stomach, you can see here that on the left side the space is already closed. Who is closing the left side space? Between the spleen and here in the left colic flexure, there are phrenico-colic ligament. That means the diaphragm and the colon, they are connected by phrenico-colic ligament. Not only that, stomach and spleen, gastrosplenic ligament. So, all this ligament lying on the upper left part does not allow any fluid to go to left paracolic gutter.